African trypanosomiasis, caused by Trypanosoma bruceigambiense and Trypanosoma brucei-rhodesiense, also known as sleeping sickness, is transmitted by the tsetse fly. Trypanosoma cruzi is the cause African sleeping sickness, also known as Chagas disease. The life cycle of Trypanosoma cruzi involves the human and animal as the reservoirs and comprises of following two stages. The first one is the triatomine bug stage, and the second one is the human stage. The cycle in the rejuveate bug begins with ingestion of trypamastogotes in the blood of the reservoir host. In the insect gut, they multiply and differentiate first into epimastogotes, and then into trypamastogotes. When the bug bites again, the site is contaminated with feces containing trypamastogotes, which enter the blood of the person and form non-flagellated amastogotes within host cells. Epimastogotes multiply in the midgut as well as the hindgut. To complete the cycle, amastogotes differentiate into trypamastogotes, which enter the blood and are taken up by the rejuveate bug. The pathogenesis of trypanosomiasis consists of following steps. The amastogotes can kill cells and cause inflammation, consisting mainly of mononuclear cells. Cardiac. Muscle is the most frequently and severely affected tissue. In addition, neuronal damage leads to cardiac arrhythmias and loss of tone in the colon and esophagus. During the acute phase, there are both trypamastogotes in the blood and amastogotes intracellularly in the tissues. In the chronic phase, the organism persists in the amastogote form. Chagas disease has occurred in recipients of either blood transfusions or organ transplants from infected donors. The organism can also be transmitted congenitally from an infected mother to the fetus across the placenta. Moving ahead, the epidemiology of trypanosomiasis can be studied. Acute Chagas disease occurs rarely, but the chronic form causing myocarditis and congestive heart failure is seen with increasing frequency in immigrants. The disease is seen primarily in rural areas because the rejuveate bug lives in the walls of rural huts and feeds at night. It bites preferentially around the mouth or eyes, hence the name kissing bug. The clinical findings of Chagas disease are listed. The acute phase of Chagas disease consists of facial edema and a nodule also called chagoma near the bite, coupled with fever, lymphadenopathy, and hepatosplenomegaly. A bite around the eye can result in unilateral palpebral swelling called Romanes sign. The acute phase resolves in about 2 months. Most individuals then remain asymptomatic, but some progress to the chronic form with myocarditis and megacolon. Death from chronic Chagas disease is usually due to cardiac arrhythmias or congestive heart failure. It is important to know the correct diagnostic criteria before treating a particular disease. Acute disease is diagnosed by demonstrating the presence of trypamastogotes in thick or thin films of the patient's blood. Both stained and wet preparations should be examined, the latter for motile organisms. Because the trypamastogotes are not numerous in the blood, other diagnostic methods may be required. A stained preparation of a bone marrow aspirate or muscle biopsy specimen, which may reveal amastogotes. Culture of the organism on a special medium, and xenodiagnosis, which consists of allowing an uninfected, laboratory-raised rejuveate bug to feed on the patient and, after several weeks, examining the intestinal contents of the bug for the organism. Serologic tests can be helpful also. The indirect fluorescent antibody test is the earliest to become positive. Indirect hemagglutination and complement fixation tests are also available. Diagnosis of chronic disease is difficult because there are few trypamastogotes in the blood. Xenodiagnosis and serologic tests are used. The drug of choice for the acute phase is nifurtimox, which kills trypamastogotes in the blood, but is much less effective against amastogotes in tissue. Benzidazole is an alternative drug. There is no effective drug against the chronic form. To prevent the occurrence of trypanosomiasis, the following preventive measures can be taken. Prevention involves protection from the rejuveate bite, improved housing, and insect control. No prophylactic drug or vaccine is available. Blood for transfusion is tested for the presence of antibodies to Trypanosoma cruzi. Blood containing antibodies should not be used. That is all about trypanosomiasis.